Good morning. My name is Erin Colburn. I am the Pre-Health Advising Coordinator for the College of Health Sciences, and I am thrilled to introduce you to one of our previous alumni from Boise State University, Taylor Willis, who is an occupational therapy student at the University of Mary, finishing out her doctoral degree. She is here on loan from the University of Mary to help us provide some programming for you as students. This programming is excellent, and I am going to turn the time over to her so that she can give you this well put together presentation. Go ahead, Taylor.
Thanks, Erin. So like she kind of discussed, I'm an occupational therapy student, and so that's the lens that this presentation is kind of be seen through. And so today we're focusing on health management and physical education. But before we get into it, I have a 10 times more important question. Are you a French fry person or a tater tot person? This is crucial. There's only one answer. What are we feeling?
You want answers
French
spoken
fries.
or in the chat?
Just say
Either.
it.
Tater tots.
Ooh.
French fries. French fries.
I'm sorry, I'm going to have to leave now.
No.
Me too. Tater tots.
You know what tater tots are, right?
No what?
They're the
Sorry?
babies of, you know what tater tots are, right?
Fries,
They are
but more evolved.
They're the babies of French fries.
Oh, okay. I think you got that a little bit backwards, but all right.
Well, where do you think that they're the pieces? They're the leftover pieces after they cut the fries.
It's true. It's the same way that the donut hole is the best part of the donut. It's the little leftover part.
That would be a good one, Taylor.
Oh, wow. That was
Alden, that was awesome.
That was a big moment in my brain. I think I just had an epiphany. Whoa.
Taylor, which one's your favorite?
Mine are French fries, but I love both. But number one, I'm a French fry gal. So, but your analogy may sway me. That was pretty powerful. Okay. So like you said, I'll let the tater tots stay, even though French fry was probably the right answer. And so you're probably thinking, who are you and what exactly is occupational therapy, right? And so occupational therapy is a newer profession. It started in the 1900s-esque. And so it was centered around the idea that people with disabilities as well as the mentally ill were institutionalized or imprisoned. And so they weren't participating in any activities and they were just left there. And so occupational therapy started within that kind of realm to focus on the therapeutic use of daily activities, or what we call occupations, hence occupational therapy, to promote meaningful participation in an activity. And so that's kind of where it started, and it's evolved since then. It's still in the mental health, but it also is within rehabilitation and other different settings. And so with that kind of lens, everyone has different roles, everyone has different expectations and tasks they have to complete, and all of those intertwine. And so that's what this workshop series kind of looks at, is these different aspects of student life that affect us as people. And so health management is kind of a broad term. And so what do you think that entails? What do you think is kind of encompassed in that term?
I guess like mental and physical and social health sort of all rolled into one.
Yeah, for sure. That's a great kind of sum of it. Anybody else think what might else be encompassed in it? Well, I like how you summed it up. That's actually is a really great kind of sum of it. And so this is the definition of it on the occupational therapy scope of practice. And so kind of what we are focused around and what we are allowed to do within that scope of health management. And so it's activities related to developing, managing, and maintaining health and wellness routines, including self-management with a goal of improving or maintaining health to support participation in other occupations, right? We have to be physically well. We have to be mentally well. We have to be socially well to be able to be a healthy and well person, right? That kind of makes sense. It's all encompassed. And so the scope of practice also kind of divides it into these specific categories. And so the first one is social and emotional health, promotion, and maintenance. And so this includes your ability to identify your personal strengths. You know what you're good at emotionally. You know what maybe your weaker points are, right? You have a self-awareness of those. Your ability to manage and express your emotions. That takes time, that takes skills. You compare an adult to a toddler, right? One of them is a little bit better than the other at managing their emotions. And then also seeking out occupations that improve wellness. And so you want to be participating in things that make you better, they make you feel better, not things that are going to put you at risk or might ruin your day, right? That doesn't really make any sense. And then also your self-identity. So this kind of goes with your self-awareness, like who you are as a person. That also can impact all the activities that you do. The second one is symptom and condition management. And so this can be physical, mental health needs. It can be kind of your behavioral patterns. And so understanding how all those things affect other things. Managing your chronic illness. There's chronic illness across the lifespan. And so there's 10-year-olds dealing with it, there's 18-year-olds dealing with it, and there's 60-year-olds that are having to deal with their different conditions and symptoms. And so that's something to think about too. And then there's communication with the healthcare system. And so this is verbal, written. I think the world is going digital now, right? So everything is online. And so that can be really difficult in means of advocacy and communication due to that not everybody has all those means or resources. And a lot of people, I mean, even like 18-year-olds are still having their moms call for like a dentist appointment. I still make my mom call sometimes. I'm like, it'd just be easier. Can you just like set it up for me? Right? It's that anxiety and that's what's affecting like the student population. And so it can be hard to have those honest conversations with our physicians, with our dentist, if we can't even set it up right. And so that's something to kind of think about too. And then there's medication management. And so you have to know and set up a yearly visit so that you can get your different referrals, right? You have to be able to know when to take those medications. You have to know when to take the right amount, in what order, what with, if it needs to be taken with food, without food, things like that. And then kind of like Dalton was saying, physical activity, right? Nutrition management. Those are some big ones that I think everybody knows is encompassed in their health. So it includes, cardiovascular strength, everything that is involved within your physical health. And then nutrition management is the education of nutrition as well as adhering to a nutritional plan, as well as preparing meals, right? Oh, some of us can't cook. Some of us never learned how to cook. Our parents still cook for us. And so that can contribute to your ability to eat healthy. So, I mean, what's easier, the microwave? On most nights, yes. The quick little microwave meals, that quick microwavable burrito, it's not the most healthy and has quite a bit of sodium in it, but that's what I can do in this time period. And then there's personal care device. And so, or personal care device care. I think I switched it. Yes, okay. And so that is maintaining your personal care device cares. Whoa, it's a Monday. And so for me personally, I have glasses, right? So I have to keep them clean. It's insane how many smudges I can get, and I feel like I don't touch them. But other individuals have like contact lenses, right? That takes a lot of care. You have to make sure that you're not wasting them, you're not leaving them in, things like that. Others have wheelchairs, walkers. You might have other adaptive equipment to help you get dressed, things like that. You have to be able to maintain those as well as use them properly. And so that's kind of all of the categories. And so I love this meme. This sign can't stop me because I can't read it. And so you're kind of like, well, those don't all, I don't know if that technically resides with me, those categories. And so which of them do you feel the most applicable to you? So as you were kind of reading them, and I'll go back up to them, which ones are like, oh, wow, I maybe didn't know that was something, but I do have that within my life, or yeah, this is something I do every day in my life.
I'd say for me, the one that I hadn't really thought about as much was the personal care device management. I wear contact lenses, and so I've done that for years at this point, so I'm just kind of used to it.
Mhm.
But yeah, definitely making sure that I'm not wearing them all the time. I'm not sleeping in them, things like that. I don't, yeah, I forget sometimes that that's a thing that I have to do that most people don't have to deal with.
Yeah. And that is just another like another checklist, right? It's another thing to add to your morning routine.
Yeah.
And it's another step of responsibility. I can't go to bed with it, like I have to take them out. I have to make sure I put them in the morning. That's an extra step that some people don't deal with. And so it's something to understand with thinking of other individuals' health management as well, right? You don't know what their routine is. You don't know what they have to do. And so thank you for sharing.
Yeah, for sure.
Anybody else? I think we got some.
Oh, you got one in the chat.
Okay. I'm not very good at medication management. That one can be hard. I mean, there are apps and there's different things to actually help people with that, especially older individuals with like cognitive disabilities. That can be hard. Even me, I'll wake up at the same time every day. I'll want to take my medication, but sometimes I just forget. And sometimes you have to take them at specific times, and it's not good to forget. And so that is something to think about, is that especially as you get older, or even people our age, they have multiple medications to manage. And on top of just taking it, you have to make sure that you continue to get them, because some only come within like a year supply. And so you have to make sure you can get to your doctor every year, which not everyone can do either. Thanks for sharing, Mary.
I would also say, I remember being, when I was in college, like I kind of lived paycheck to paycheck because I was a first generation college student. My parents couldn't help support me in college. And there were times when I was living in the resident halls and I didn't make it to dinner. Like I didn't make it to the cafe to eat. And like, then I had to go scrounging for food, right? Like in my little fridge, and feeling some of those food insecurities and some of those things, those aspects.
Mm-hmm. Yeah, that can be challenging. I even think like for a lot of people just forget and then they don't eat. And then what's your choice, right? Your choice is, especially at Boise State, the pod at Chafee, like that isn't the most healthy. There's not great choices there. Your options are like granola bars, cereal, or anything microwavable that is just packed with sodium. And so that is a really interesting point. Thanks for bringing that up, Erin. All right. Well, thanks for sharing, everybody. So we'll kind of lean forward into kind of another category, another aspect of it that I think a lot of people are starting to see, and we're starting to see within our healthcare system, which is prevention. And so that's preventative versus reactive medicine. And in the older days, it was reactive, right? Like my leg got cut off, or like I feel terrible, I'm dying. That's like reactive medicine, right? You're just waiting for something to happen to your body, and then you're going to get it fixed. But now we're kind of in this preventative medicine. And so if we can prevent some of these preventable things, we don't have to spend as much money as a healthcare system to deal with it. And it helps you, it helps the healthcare system, it helps healthcare professionals, right? It's a win-win-win. And so we must first accept the items that we cannot change, right? We can't control or prevent everything that ever is going to happen to us. Our bodies are these crazy beings that just do whatever they want, right? But there are different risks that can contribute to that. So if we can control the risk factors, right, there are things that we can influence, then we can prevent or just delay the development of these chronic diseases, which just gives us more time. It gives us more freedom within our life, and it can increase longevity, right? And so some of the risk factors that I think a lot of people know, but it's always nice to go back over them, is tobacco use, excessive alcohol, hypertension, or high blood pressure. This one is linked to stress, right? There's a lot of things that kind of influence this. It put a lot of stress on your heart, which can also is kind of a big thing with heart disease, and which is a huge problem in the US right now. Physical inactivity, so just not moving, obesity, an unhealthy diet, and then raised blood glucose, or those sugars within our body. But like I said, the good news is these are things that we control, right? Sometimes it can feel like we don't control a lot of things in our life, but these factors, right, these health contributing factors, we can influence and change. And so this kind of leads into physical education. And so it's understanding the difference between education and activity, right? Everybody can partake in physical activity. You can go out and take a walk, you can go out for a run, but not every school district, not every individual has gotten a specific physical education. And if you have, I think a lot of people get different pieces of it, but it's not like a comprehensive education. And I don't think I understand this until my boyfriend is a physical education major and he told me all of these things that they're teaching these kids now. And I'm like, oh my gosh, what? I did not learn that. Like they're learning about food, they're learning about their bodies, they're learning about the muscles in their bodies and how those influence things as fifth graders. And that blew my mind. And I think a lot of people get health education. And so but about that goes as far as maybe sexual education, right? STIs and kind of that aspect and how to prevent those. But our body is so much more than our reproductive system, right? And so you have this physical education, then there's health education, which I just don't think a lot of people are getting. And you're a product of your school district, right? I mean, K through 12, you know and learn what they teach you. And if individuals don't have those resources at home, they don't have those resources in their community, or they just don't know about those resources, then everybody's not going to get the same education. They're not going to know the right things. And if you don't know how physical activity impacts you, you don't know what's best for you, you don't know what you love, you haven't explored that, it can be really challenging to partake in it. And so I think that is a contributing factor and things to think about, is that even in college, there are things I didn't know about my health until I got there. And I was 20 years old and I'm learning these things that I feel like I should have known my whole life. And so I think that's a really important kind of distinguisher to kind of understand health management within ourselves, but also other people when we're looking at the community, when we're looking as health practitioners to people. Okay, and so I found some research that kind of goes over this specifically with physical activity, which I think a lot of people know. It benefits us, right? It's endorphins. We like it. It's good for our bodies. It affects a lot of things, but I still think it's nice to look at the specifics. And so this first one is that individuals who engage in physical activity demonstrate psychological wellness and they suffer less from stress and depression, right? We like physical activity. It does nothing but help our body, right? It makes us feel better. Those endorphins are little drugs that just help the stress go away. That is a common thing that I think a lot of people know, but sometimes we forget, right? We're like, oh, we got to go to the gym again. Well, no, let's just get our body moving, and then maybe that will impact our mood a little bit. So the middle one is undergraduate students with higher levels of leisure time physical activity scored greater in emotional regulation, but specifically emotional attention and emotional repair. And so not just, oh, I got to go do this, right? People who chose to do this as an activity. I'm going to go ride my bike on the green belt, or I'm going to go walk across campus to the Micron building or something from my dorm. I'm going to take those extra steps. Then they actually scored higher in emotional regulation. And so if you feel like you can better control your emotions, then maybe you can better impact those activities that you have to do in your life. And so I thought that was kind of interesting too. And then this last one is that undergraduate students who met their vigorous physical activity requirements were less likely to report poor mental health. And so poor mental health just is kind of like you're really, really stressed, right? You're feeling anxious, kind of those main markers that a lot of students feel. So the individuals that were getting their heart rate up, right? Were working their cardiovascular system as well as maybe doing some strength training, things like that. They were less likely to report those markers of high stress and anxiety. There we go. And so let's take a few minutes and we can kind of reflect on your favorite ways to stay active. So what are your favorite ways?
I normally start out the morning with like a 20 to 30 minute walk or so, just to kind of, get some cool, fresh air in the morning and, get outside, get moving around a little bit.
Yeah, I love that. I love that it's part of your routine too now, and that it helps you. I really like that. That's awesome.
Thank you.
In the mornings, I do an intention setting. So like just take 10 minutes and sit and get myself kind of right in my head and relax that way. And then we play video games in this household. So we often get into competition with Minecraft building or Mario Brothers. So
yeah, I like that too, because I think like getting excited and that like play aspect, that can be considered activity, right? You got yourself out of bed, you're maybe standing up, you're cheering, you're talking with people. That is still an active activity, right? So I like that. I like that you've also introduced kind of play and leisure within it, and you're enjoying your kids in that moment. Anybody else? What do you guys do to stay active?
I like to run, and
You go, girl.
yeah, and then I have two dogs that require a lot of activity. They're neither of them are lazy, as you've heard them in meetings before. They're not.
Isn't that the worst? You're
Oh,
like, just
man.
lay down. Just relax.
Be fat and lazy right
Be
now.
fat and lazy, right?
Yeah, and then we're also video game players in my household, and that can actually be pretty active, especially if you're getting a little bit angry with the game.
For sure.
Arm movements, flailing.
Right, that's some strength.
Yes.
Jennifer also mentioned in the chat that she enjoys Pilates, tries to find some time throughout her day to participate in those activities.
Oh, wow, nice. I love group fitness and I love those type of classes. And so I think that's also a really great way for people who don't know how to stay well, or they don't know what works for their body. They don't know the type of activities they need to do for strength. That workout classes are a great avenue and bridge to kind of bridge that gap. And so I really like that. That's cool. I love pickleball. I'm a big pickleball person. And you think like the miniature court would be easy? No, it is intense. Like that is a full body workout. I am sore after. That's intense. I'm a pickleball gal. Anything else?
Ellie walks her dogs.
All four. Holy cow. A party. Oh yeah, yard work. That is something that a lot of people I don't think understand how much work it is. I helped my dad pull weeds for 10 minutes and I thought I was going to die. It was intense. And so moving, right, those different, especially I think in the spring of all, everyone gardening, the different soil, picking up the plants, things like that. Yard work takes a lot of work. Thanks for sharing. And so this was kind of, it was done by the Public Health of England, but it still applies, right? And so these are kind of similar activities that count as moderate intensity cardiovascular physical activity, right? It's getting your heart flowing. And so the first one is like walking, right? If you can fast walk, you see those little arms moving, that can be a workout, even going uphill or going like off terrain, all road, right? Kind of maybe choosing to go hiking, things like that. That gets your heart rate up. Swimming, water aerobics, that is crazy too. I have a laps pool in like our little community, and I think I did like one lap, and I couldn't keep going. So I give tons of props to swimmers. Bike riding, right? Hiking, gardening, pushing a lawnmower, even dancing, like any active recreation. I also think housework and domestic chores, like that goes in with gardening. I mean, keeping your house management, doing all that cleaning, right? Pushing furniture if you're moving, that's a lot of work too. And then carrying or moving moderate loads. And so that can also kind of fall under the gardening and the housework. And so I like this because I think it goes beyond just the basic go to the gym, walk on the treadmill things. This shows you that there's lots of ways to get activity if maybe you're not that type of person or you don't enjoy just going to the gym and lifting weights, right? That's not going to work for everybody. And so that's why I kind of like this graphic. And so as we're kind of talking about this, I think sustainability is a really great word. We want to do things that we're going to keep doing, right? We want a lifestyle that we love and that we chose. And so when maintaining activity, the best physical activity is the one that you're going to do, right? We have to stay active, right? We can't not be active human beings. We know the impacts it has on our body, and we know that we need to understand our BMI, right? We need to be able to be at a healthy weight and be in good cardiovascular activity as we age. And so we know that that's a fact that I think a lot of society knows. But physical activity can be more than just going to the gym, right? What are we going to do? What do we love? Are we going to play pickleball? Are we going to go on more walks in the morning? Are we going to play more video games with our kids? What are we going to do, right? And then I think with this too, nutrition. And so we all know the importance of good food. I think you've learned that throughout school. You've learned that from your family. Some maybe not. That is a topic that requires education. And so with that, educate yourself. Do some research on reading those labels. I think some people already do that. I know I do, especially in the grocery store. I take my time. I understand what's in the food so that you can better understand what's going in your body, right? And then I think with that, moderation. If you want the pizza, eat the pizza, but just don't eat pizza every day. Or you want the pizza, eat a slice and maybe have a salad with it, right? It's not cut everything out of your diet. Gluten is the death of me, right? No, unless you're gluten-free or intolerant. But those things that if you enjoy it and it feels good, do it, right? But we want to be able to sustain healthy activity as well as a healthy diet. And so with this comes nutritional labels. I kind of talked about it. And so I liked this graphic because it kind of goes through it in a really quick way so that you can better understand the quick kind of 1, 2, 3s. What do I want to look at, right? And so one is the like health claims on the box, right? These are the good things. Like, of course, they want a nice and big. They're the things that have 0 trans fat. They have some vitamins in them. But that only highlights the good things, and some of the more maybe shocking things are actually in the nutritional facts. And so don't just take it at face value, right? You got to do a little bit of digging. And then the second is the serving size. That can be surprising, especially with Pop-Tarts. I love Pop-Tarts. Go brown sugar. I'm a fan. It's only 1 pastry rather than 2 pastries. And so although you get a package, you think like, oh, that's 1 serving. Sometimes that can be surprising. I think like Top Ramen, the serving includes only half of it. And you're just like, whoa, it already has a massive amount of sodium. Then you double it. You're like, oh, was that a good choice? I'm still going to eat it, but maybe not the best, right? And then the third one, I liked that they kind of divided it into 3 S's. So they were saturated fat, sodium, and sugar. And so those are kind of the big markers to kind of think about. And it's kind of, I would definitely look up the like recommendeds from a government site, like what we're supposed to be eating. But saturated fat, kind of the length of sodium, it does give you your daily value percent, but sometimes it's nice to see the actual grams or milligrams that you're supposed to be consuming. So those kind of big things, the added sugars, things like that, is something to kind of always look at. For 4, if it has fiber and it has protein, that's pretty good, right? Those are some things to look at and to know that those are positive. So if there is 2 grams of protein, well, that's some protein, right? And fiber, that less than 1 gram, not the best, but it has some. And so that's things to look at as we're kind of going through it too. Those are the positives. And then the ingredients, and so it is listed by quantity. And so the one at the top is the most within the product, and then the bottom is the least. That can be surprising. I think I looked at Cheetos and it was like red color 10, and I was just like, whoa, that's an ingredient that I'm putting in my body. That's just kind of mind-blowing. And so there's like those little things that you're like, maybe I shouldn't look at this, maybe I shouldn't think about this, that kind of can surprise you. And so I definitely recommend looking through some of your favorite foods. And that's what our next activity is actually. And so think about your favorite food, or think about something that you eat a lot, and then you can either Google it or you can go to the kitchen and grab it, and then kind of let's look at it and see what we find.
All right, what kind of stuff were you looking for? Like which?
Yeah, we can pull that back up. So if it has any of these like health facts, or even just look at the specific nutritional facts and just see kind of following that guideline. Oh, it says a lot of sodium, holy cow.
Oh,
Or
actually,
what is this ingredient? Maybe Google the ingredient, see what it is. That can kind of be surprising.
let's see.
So I
Yeah,
ate this.
I'm on campus right now. The only thing I have with me is like a protein shake, at least
Okay.
that like actually has a label on it. So we're going with that.
Okay.
Let's see.
So I have this granola I eat, and I always chuckle because the serving size is 1/8 of a cup.
Oh.
So, and there's 8 servings in it. I usually do 2 servings because 1/8 of a cup is
Right.
not enough granola.
Eighth of a cup is a bite.
Yeah, it's pretty much a bite. But the thing of it is it's like, so it has a total carbohydrates of 10 with a dietary fiber of 2. So you end up with 8 net carbs with it, but I gotta times that by 2 because I can't eat 1/8 of a cup.
Right? Granola is one of those sneaky things that I have found too. Their sample sizes or their serving sizes are so small, but they pack a lot of those other aspects and carbohydrates and things like that in it. So that's interesting.
It's supposed to be one of the lower carb ones, but that one's mine.
Thanks for sharing.
Sadly, my protein shake does not really have anything particularly interesting on it.
What's the serving size?
1 carton, because it comes as a
Okay.
little, yeah. Fortunately, it's not like, yeah, just drink half of it.
Right.
Yeah, 32 grams of protein, 1 gram of sugar, and 0 grams of added sugar. And then if you look on the ingredients list, it's basically milk protein and milk protein derivatives, and then less than 1% of a bunch of other stuff.
Okay, that's not too bad. That's pretty good. I think sugar is a big thing, like with those types of drinks that I think we're starting to think about, but it's important to track our sugar, and I don't think a lot of people do it efficiently.
Yep.
And so it's kind of nice that doesn't have a lot in it.
Yeah. Okay. Story time, real quick, because that reminded me of something.
Okay.
So I drink a lot of protein shakes because they're easy and they're good on the go. But one morning I had forgotten to put one in my backpack, and so on my way to campus, I just stopped at the gas station. I was like, I'll just pick up whatever protein shake they have, something, it'll be fine. And I bought a Nestle brand chocolate protein added milk drink. And it probably like, so the serving size was half of the bottle, which no, I'm gonna drink the whole bottle. But in that serving size, I think it had like 11 grams of protein and like 32 grams of sugar. I was like, this is not a protein shake. You guys are lying.
That is shocking. And that's the things that people buy that. And if they only have a gas station down the road, right? Some people don't have grocery stores near them. That's what they get. And they're like, okay, I need a protein shake that's healthy, right? They eat that or they buy that because maybe it's a cheaper option. And it's hidden with things that just isn't as good for our body as maybe some other items.
Yeah.
So that's interesting. Half a Red Bull. Oh,
Wait, you got look at this. Okay, so it's sugar-free to start out with, vitalizes body and mind. And on the back, it says Red Bull is appreciated worldwide by top athletes, busy professionals, college students, and travelers on long journeys. It's a low calorie product.
Oh,
Okay.
So see, totally healthy for you.
yeah, totally. Athletes do it. That means we can do it. It's
And
just
college students, it's fine.
Yeah, I was gonna say they have not mentioned their target demographic, which is
Yeah.
tired freshmen who forgot to write their term paper until the night before.
Exactly.
Oh my gosh, that's hilarious. So we have some people who did it in the chat. It looks like Ellie looked at some Marie Callender's pot pies. Love those. But they have 28% of your total daily fat. That's a lot. Wow, that's kind of a big number. And then Mary looked at her butter, a container of butter, and that only one serving size is a tablespoon. And I don't know about you, but my toast is pretty slathered. So that means you probably put 2, maybe 3 on, especially in different meals. Wow, that's kind of surprising too. I don't think I knew that. And then Jennifer looked at hot Cheetos. Good pick. A serving size is 1 ounce. How much is that, right? Who has a scale? And which is about 21 pieces, which is not definitely what I usually eat. True. 1 ounce, that's nothing. I agree. Wow, that's really shocking. And so it's those little things, right? It's those things that maybe we don't want to look at. And we're kind of like, if I don't know, it won't hurt me, right? But I just think as you kind of think about sustainability and you think about just picking some healthier items, being cognizant of these things, right? You don't need to look at everything. You don't need to make serving sizes. You don't need to measure everything. It's just make sure you understand that if you're consuming only foods that maybe are shelf stable and they're not as good for our bodies, that you need to understand these factors. But if you encompass this with maybe some other things, right? Some things that are like outside of the grocery store, people always say stay on the perimeter. Those healthy, the healthy produce. I was like, what are they? Vegetables. The healthy produce, things like that. That coupled with these things means that it's more sustainable and just a little healthier for us. So thanks for participating, everybody. Hopefully you found some shockers, right? And then so the last thing, so kind of the main categories that I felt were really pertaining to students were physical activity, nutrition, and then like you said, the social emotional health promotion. And so this is a big part of our life, I think, especially in like the world of COVID right now. And so this encompasses our ability to make choices to improve our quality of life. I kind of talked about that earlier, right? We don't want to do things that hurt us. We don't want to do things that put us at risk. Even if it maybe we don't know exactly or we're not 100% cognizant of it, we, at least on the scale of things, want to be up on the good things that we're doing for our body. And so we got to think about that, as well as choosing activities that support wellness. And so that kind of goes with everything that we were talking about and just being cognizant of. And then emotional regulation. So our ability to control our emotions, our ability to choose what emotion we're feeling, to hide some emotions and specifically give an emotion at work or maybe at school, right? We may be feeling really, really sad or really, really isolated, but I can't show that in my class. I can't show that in a meeting. It's not the place or it's not the time. That's something to think about. And so stress management, right? I think students feel that a lot. It can be really hard to manage that. And so understanding what coping skills do I like, what coping skills work for me, what can I do to manage those things. When I'm having a rough day, what do I choose? I think walk is a really awesome one. Like Erin said, her intentional 10 minutes, those 10 minutes she spends really relaxes her. I do something similar and it really helps me kind of set intentions for my day, but also start with a really strong foundation. And so those are things that to kind of think about, what are my coping skills and are they benefiting me? And then kind of with that, I think you introduce COVID, right? You introduce this world of Zoom that we're on right now, right? It doesn't mean that we can't participate in social participation, but it really makes it challenging. And so I think a lot of individuals are feeling that impact of COVID, and that comes with it. And so these specific kind of numbers were pulled from a specific survey done by Emily Gravel with Bronco Fit, and it was completed in December of 2020, and it was focusing on student wellness. And so these are your peers on campus and what they're feeling. And so 61.68% have felt isolated or sad during this COVID-19 pandemic. And so a lot of people are feeling that, and that's adding stress, it's adding different emotions to your ability to emotionally regulate, right? To be a regulated person. And that can be really challenging to deal with. It can be really challenging to kind of tip that scale to where you are. And so I found that kind of a surprising number. And then 62.19% of students have experienced disappointment or sadness. That can be really challenging as well. I think when we're disappointed or sadness, it pulls similar symptoms as depression, right? It decreases our motivation. It decreases our ability to maybe be a student, right? And that is one of our main roles right now, is to be a successful student, to finish our classes, to pass those tests. But if we are having these other symptoms of our emotions just kind of feeling really down, we're having that depressive kind of pull, that can be really challenging. Then the last one, 8.77% of students have not been able to access their healthcare provider. And so that's 10% of students almost 10% of students on campus are feeling like they don't have anybody to go to within the healthcare field, right? They can't access it. Maybe they don't have strong internet and they can't do telehealth. That's something to think about. And so there are on-campus counseling services. So if you're feeling these things or you're feeling overwhelmed, they do have different healthcare providers that can support you in those things. And I think also there's the food pantry on campus, right? So if the food insecurity or you're not finding healthy food for yourself, there's a dietitian that has set up meals on the campus to support that, right? So there are these disparities within health management and our ability to manage our wellness. And I think students are going through that. And I think COVID has only heightened a lot of the problems that has already been on campus. And so understanding that those are resources that are available to you as a student for free. And so if you're feeling any of these things, that it is totally okay to outreach to those or outreach to someone who may know more about them. Whoa, there we go. And so following this, do something that makes you feel good, but is also good for you, right? Do something that you really enjoy that's going to benefit your health after this. Go for that walk, cook a healthy meal, have a dance party, listen to your favorite podcast. That's one of my favorites. I love a good podcast while I walk. Just choose something that brings you joy, right? That you're going to love to do today, and then make sure it's good for you. And so that's my presentation. Are there any questions that you have for me?
If nobody else has any, I wrote down a few while we were going through stuff.
Mm-hmm.
So first of all, when you talked about communication with the healthcare system, I was curious if you notice in people that you help with like that form of communication, if they also improve at like general communication as well.
Yeah, I think it can be challenging because I think the healthcare, if you don't know anything about healthcare, it is a really scary field. It is a really big unknown that a lot of people don't know. And as an OT I was in a hospital setting for 12 weeks, and they would get finished with their doctor, right? I had to wait because the doctor is priority. And then I'd go in and they'd be like, what am I here for? Like, what was my diagnosis? What does this mean? Like, what? I don't understand that. And so I think there's also this, like, the doctor is the doctor, right? You don't want to ask questions. I'm smart. But there's this healthcare communication also bridge that they use words, right? We want to make sure we're using layman terms so that everybody knows. The average like reading age in the US is 6th grade. And so you want to make sure that your communication is within that 6th grade reading level. And so that can be really challenging. And so I think if you aren't comfortable talking to the doctor, I think some of those other professions, even your nurse, that helps. And having that open communication and sitting down and taking that extra step, being like, what don't you understand? What do you need help with? I think that really does improve communication. And I feel like I've seen that a lot in the hospital, is that there's just so much happening that they need a moment to talk with someone. They need a moment to figure that out. And so it is challenging.
Okay. Thank you. I have another one, and this one is kind of a long shot. But when you talked about physical education and how different people get different things taught during their physical education, I was curious if you knew of any like longitudinal studies that would examine like different curriculums that were taught and then how that affected people's health later in life.
Yeah, I don't know any on the top of my head. I think that was a really big observation that I personally felt as reflection. But it makes sense. I think a lot of us align with it. I think that's really interesting and a really cool topic that I don't think I even thought about finding research for. So definitely put your email in the chat, and I would love to look that up. I'll ask my boyfriend, who's a physical education major, to see if he had any in his classes, and then I'll email them to you, and maybe we'll find something interesting.
That would be really cool. Thank you. I just sent my email right now.
Okay, perfect.
Yeah, that's spelled right. And then I had one more question. This is just the last thing I have. With that COVID survey about people's feelings during COVID, I was curious if they included any questions about how many people were experiencing those sorts of emotions before COVID, just so you could track an uptick. I know college is generally like a really big change in people's lives, and it can be kind of isolating, especially for people first coming to college. I know I felt that way some my first year, even though there was no COVID at that time.
Right.
So I was curious if they included any of that.
This survey was a specific cross-sectional, so it was looking at a specific time, and so I don't think they did that. It was much more after, and
Okay.
so I'll reach out to Bronco Fit. I have a meeting on Wednesday with Emily, and maybe I'll see if they did one before, similarly looking at wellness, and if they've compared them. It was in the beginning aspects. They just collected it in December of 2020.
Gotcha.
And so I don't know if they've done that. And so I'll ask her and kind of see if they had stuff before. But a lot of research across the US has shown that it has increased. And so there are numbers previously. This specific Bronco one, I don't know if they did something like that. But from my research, from just looking at other universities as well across the US, it has increased in comparison to the previous numbers that they did have.
And Dalton, it's an ongoing survey too, so like they're sending it out again. So
okay.
They've done it. It's an ongoing study. So like within this last year, it's being piggybacked on a couple of other surveys and things like that. But they've sent the survey out when somebody filled it out, and then they are coming back and have things changed even from like the last 6 months. So I think it's an ongoing kind of cross-sectional survey, but Taylor can certainly ask Emily the ins and outs.
Cool. All right. Well, thank you guys very much.
Yeah, thanks for your questions.
So did anybody else have questions?
I don't have a question, but one thing I did notice that I have noticed, and maybe it's not true everywhere, but COVID sucks. We all know that. But one thing I did notice with COVID, it was that, yeah, we couldn't go places, we couldn't go out to restaurants, we couldn't go to movies and stuff like that. But what I saw was a lot more people were taking an opportunity to be outside. And so I just moved to Boise from Idaho Falls, where they have the river that entered the town in the middle of town, and people walked around that more, and people were going hiking and doing things in the outdoor. And so I don't think that COVID was by far amazing or awesome, but I do think that a lot of people took an opportunity to be a little bit more healthy.
For sure. I think that's a really awesome observation. And I do agree that I think you being stuck inside, I think people loved it the first month, right? They're like, oh, I can lay in bed, I can relax. And then the reality set in of what this is and what this weight of this pandemic is. And I think a lot of people have chosen to maybe just walk around there. Like, I got to get out of the house, go to the grocery store, or take a walk around there, like maybe housing development, or take a walk downtown or something. And so I do agree that people are trying to take a step and they are seeing those benefits of getting outside. So I like that observation. Okay. And so in the chat, I'm going to put this link. Hopefully it works. I always grab the wrong link. I think I did the right one this time. To a feedback form. Takes about a minute. Definitely fill it out. It only helps me and helps you guys as I'm kind of preparing this programming. And then if you want to talk more specifically about the profession of occupational therapy, or even just want to talk about mental health or different things happening on campus, that's my email right there. You can also email Erin Colburn and set up a meeting with me, or come during drop-in advising, and I'd love to meet with anybody interested. And that's all I have for today. So I really appreciate everybody coming, everyone participating. I thought that this went really well, and I hope you guys pulled something from it and something was beneficial. And next week I'm doing one on sleep and rest, which I think everyone can benefit from. It's going to be 9 a.m. again at this time at 9 a.m. on the next Monday.